SARS-CoV-2 RBD IgG protein detection kit colloidal gold-based operation flow. The kit is composed of test cassette, specimen diluent, quantitative capillary, blood lancet for single use, alcohol pads. Please read the instructions carefully before operation. Before detection, take out the test cassette from the aluminum foil bag and place it on a horizontal and dry plane. Let the subject's arm hang naturally, then gently massage the fingertip to allow the local tissue to congest naturally. Clean the fingertip using an alcohol pad. Open the transparent protective cap and place the firing button port of the blood sampling needle flat on the part to be blood collected. Push the lancet down quickly until you hear a click, which means the firing is successful. Wipe off the first drop of blood with an alcohol pad. Collect the second drop of blood for testing. Note, the tip do not touch the wound. Gently squeeze the airbag at the top of the quantitative capillary. Suck the blood from the fingertip to above the scale line and then stop. Place the tip of the quantitative capillary perpendicular to the sample hole. Gently squeeze the balloon at the top of the quantitative capillary and add a drop, 20 microliters of blood sample to the sample hole. Tear off the specimen diluent. Gently squeeze it and add 3 drops, 60 microliters of specimen diluent to the sample hole on the test card. Read the results after 15 minutes. The results are invalid after 20 minutes. Negative. Only a red quality control line is visible. Positive. 2 clear red lines are visible. One is quality control line and the other is t-test line. Invalid. There is no red line and there is only t-test line, but no quality control line, suggesting that the item has a test error or the test result is invalid and the item should be retested.